You have a loved one who just had some type of a surgery, and now they go from the hospital to a nursing home to get rehabilitation or care for the surgical site. What do you need to know? My name is Justin Varughese. I'm one of the attorneys here at Parker Waichman, and I wanted to talk with you about some of the nursing home's responsibilities when they're caring for a patient who's been admitted from a hospital after some type of surgery. Now, oftentimes, patients are transferred from hospitals to nursing homes for physical therapy, rehabilitation after some type of a surgery. And one of the nursing home's responsibilities as part of that admission is to monitor and care for the wound that came as a result of the surgery at the surgical site. Far too often, what happens is the nursing staff or some of the physicians at the nursing home don't pay close enough attention to the actual surgical site itself. And as a result, those sites sometimes become infected and have horrible repercussions for the patient. So what are some of the things that you can do to prevent this from happening? For one thing, it's important that you ask questions. You ask the nurses and the doctors questions about the status of that site. How is it healing? Is the wound closing? Is there any signs of infection? Well, what are some signs of infection that you can look out for yourself? If you notice any changes in behavior in your loved one at the nursing home, certainly if you start to smell anything or you see any drainage coming from the wound, these are things that you should report to the nursing staff and to the physicians as soon as possible, and then follow up and make sure that the issue is being handled, and follow up in the days and weeks to come to make sure that the wound is in fact healing as a result of it. If you have a loved one at a nursing home who has some type of a surgical site or a wound that's been infected, or they're having some type of infection as a result of being in the nursing home, I want you to pick up the phone and give me a call. I handle cases like this all the time. I would very much like the opportunity to talk with you and see if there's anything we can do for you. My name is Justin Varughese from Parker Waichman, and thank you so much for your time.